Our meeting on privatization is taking place at an important time in the province. In less than 6 months since the provincial election, we've seen a ferocious offensive on the part of the Ford government and a fight back that is escalating very quickly. With a potential province-wide strike on Monday, shutting down schools, we should say clearly that we stand in full solidarity with the CUPE education workers who are fighting for living wages and adequate funding and services for education. But tonight we'll focus on another front line of the struggle against the Ford government, the fight to defend and expand universal public health care. We have two very knowledgeable speakers and activists tonight. I would like to ask that you hold your questions and comments until both have had a chance to speak, and then there'll be quite a bit of time probably for some questions and discussion. So we're honored to be joined by Doug Allan, a writer and researcher on healthcare. You can find Doug's writings on his blog, Defend Public Healthcare, and occasionally in the pages of People's Voice. And actually, we should put a link to your blog too in the chat, Doug. I can fish it out as you're talking.
Thank you.
We're also very happy to be joined by NATALIE MEHRA, the Executive Director of the Ontario Health Coalition. NATALIE MEHRA has been a tireless fighter and organizer for public health care, currently organizing town halls and actions across the province and sounding the alarm in the media. Thank you both for joining us tonight. We know you're very busy, and we hope your remarks here can help us to play our part in strengthening the work of the Ontario Health Coalition. If we can get practical towards the end of the discussion about how people can plug into the fight, I think that would be good. So without further ado, we'll start with Doug, and then you can turn it over to NATALIE, and then we can have open discussion at the end, if that's okay.
Thank you, Drew, and hello, comrades and friends. It's really an honor to be asked to talk tonight about the Communist Party and its long history of defending public health care and leading the fight for public health care. And I'm also extremely honored to share the podium with NATALIE MEHRA, who has led the struggle for decades for better public health care. Truly an honor to speak with NATALIE tonight. Publicly funded health care was a major victory for working people in Canada. But it also had some significant benefits for the capitalist class as well. The public system was much cheaper than the for-profit system, especially as illustrated by our sister country, America, a system which is so bad that it also threatens, it's extraordinarily expensive and threatens the social stability of the capitalist society. So there's some ambiguity within the capitalist class, in my view, on the question of public health care. However, despite the benefits that it provides to both working people and to capital, it is also provides a guaranteed revenue stream for those sections of it which are privatized and are very tempting to the profit seekers, especially now with declining growth, low investment, declining opportunities for profitable investment. Few industries have such a sure demand as healthcare and such a constant payer as government to bolster profits. More business is coming now in the healthcare industry as the Ontario population ages. And with that comes greater and greater temptation. Mostly now the attack is on public delivery. In the past, it was on, in the recent past, it was on the non-clinical services of healthcare that they've made great inroads in the hospitals in terms of privatizing the non-clinical aspects of that. But now more and more the changes are focused on privatizing clinical services. And NATALIE will talk about that. And NATALIE has done some tremendous research on that and how that privatization of clinical services has also led to the privatization of public healthcare insurance that is enshrined through the Canada Health Act. I look forward to hearing more about that from NATALIE. But I also wanted to set the stage for NATALIE's further remarks, just talking about the context that we're in right now, a very particular context, which is creating a crisis, which is helping the Ford government, which the Ford government is both enabling, but also using as a way to drive privatization. And that is first and foremost is that there is a huge and totally unprecedented capacity crisis in the Ontario healthcare systems. For decades, and the Health Coalition and unions have pointed this out, that Ontario is very low in terms of the capacity of its healthcare system. Very few, very low funding, very few beds, both on a countrywide basis and on an international basis. Ontario is an outlier in Canada in terms of low capacity, and an extreme outlier in terms of internationally. This is partly the compromise that was set up with public healthcare, where only two aspects of healthcare were actually taken over by the state, or the funding of it. That was doctors and hospitals. So there's this tremendous emphasis by the capitalist state to remove services from those areas that are protected, and especially the public hospitals, which also are cost centers. So there's a tremendous temptation for the capitalist state to move services outside of public hospitals. The Health Coalition and unions have campaigned on the low capacity in Ontario hospitals for many, many years. And by 2018, we'd achieved the odd situation where even a reactionary like Doug Ford had promised to end hallway healthcare. It had become such an issue that he made very few promises in that campaign, but the one promise he did make was to end hallway healthcare. But little progress has been made on that. And if you bear with me for a second, I'll just share my screen so you can see it. There is actually, these are my notes, my cheat notes, but there also is actually a chart which shows how healthcare employment, despite those promises from Ford, did not actually result in any increase, any significant increase in healthcare staffing, almost a total flat line. And that includes, interestingly, even includes nursing and residential care. Through the work of unions and especially the Health Coalition, we achieved historic advances in terms of promises of increased staffing. But as you can see from that gray line on there, there's actually been very little actual increase. There was for a while, and then it fell back. So we've got our work cut out there to force Ford to come through this with this. Ford has been on the offensive about this and has actually claimed that there's 3,000 new beds that have been created in the hospital system. But this is not reflected in the CIHI reports. And when unions have inquired of a hospital, well, where's the new beds that you were being funded for? We say, well, we don't have the staff. So we've got the beds, but we don't have the staff. So a bed without staff is meaningless. Things got much, much worse during COVID, as we all know. For the staff, the hospital staff, this meant fear, terrible fear of going to work. There was overwork because people were off work because there was already a terrible crisis of violence and abuse in a overwhelmingly female workforce. There was absences due to illnesses. There was an inadequate PPE. There was terrible gaslighting by the government about how the virus spread. We had a huge fight. The unions had a huge fight with the government just to try to get them to recognize that the disease was actually spread in an airborne manner. That fight actually still continues. They never use that word, airborne, and the unions still are fighting to get proper access to PPE. Tremendous gaslight, a tremendous attempt by the capitalist class to minimize and always to look for the easiest way out, so that their profits wouldn't be challenged and that workers would continue to show up at work. So there was tremendous burnout, there was fear, there was overwork. The overtime rates, according to a report that comes out from CIHI today, healthcare workers' overtime rates on hospitals were higher in 2021 than they have been in previous years. 18 million overtime hours were recorded. That's up 15%. in 1 year. That's because there's no staff to staff the facilities. At the same time, there was also thousands of new agency employees that were added that CIHI has reported, a 5% increase in that. At the same time, because the working conditions, especially in nursing homes and residential care, but also in hospitals and in home care, were so bad that there was an exodus from the system. 15% turnover in the hospitals, according to the Ontario Hospital Association, as of earlier this year. That's totally unprecedented and totally unsustainable. There's 8% of hospital jobs are vacant right now, according to the Ontario Hospital Association. Staff want to leave. Among nurses, according to CIHI today, that's the Canadian Institute for Health Information, this is government sources for crying out loud, they say that, that even among those who don't intend to retire, 24% intend to leave their job within the next 3 years, leave or change their job in the next 3 years. So more agency staff had to come in to a key form of privatization that's going on in our hospitals. A 5.5% increase, as I mentioned, 13.7 million hours more. And the result in the hospital systems is we're getting this totally unprecedented situation where there's delays, backups, closures in hospitals. One ER in the Chesley, Natalie, correct me, that has been closed for months. Incredible. That hospital's future is in serious doubt. Without an ER, there's no future for that hospital. And there was very little attempt by the Ford government to actually deal with this issue. They've made some efforts around recruitment, especially they want to bring in people from outside of Canada to rob the third world, essentially, of their healthcare staff. But nothing, almost nothing on retaining the staff that was leaving, that 15% of turnover that we're seeing in the hospitals. So they, at a time of 6.5% inflation, they sticking hospital workers. We just had an arbitration decision for 40,000 healthcare workers come out last week that sticks those hospital workers with 1% wage increases for the next 3 years, all due to Ford's misbegotten plan to reduce the wages of women workers. Anyway, more staff is needed to get this. We need to do a whole series of things to change this around. We're facing increased demand for healthcare services because of population growth and aging. Those two factors alone drive up the needs by about 2% a year. On top of that, we have to get the vacancies back down to a reasonable level. They were at about 1.5% in 2015-16. That's a normal level, not the 8% level. We have to deal with the fact that for decades, the Ontario government refused to open new long-term care beds, creating this tremendous backlog. Now the Ford government has actually recognized that as a problem in is staffing new beds, and thanks to the Health Coalition, we've won this promise of new hours. That's going to drive the need for 59,000 extra RPNs, RNs, and PSWs by 2024, 2025. We estimate that just every year, hospitals have to hire 47,000 just to meet the 47,000 employees every year, just to deal with those pressures and to deal with the turnover that is currently happening. But it's worse than that. COVID is an additional problem on top of that. It looks like the baseline need for hospital inpatient services is about 4% a year, 4% all the time, even at the lows of COVID. 4% of beds are being taken up by COVID patients. Those patients, by the way, stay in hospital much longer and cost the hospital system much more. So it's even more than 4% in a certain key way. But then we're also finding out that COVID itself has long-term impacts upon the population. And there was a recent report from the Canadian Medical Association journal that suggests that even just for those 1% of top healthcare users that have also been infected with COVID, that they're using 6.6% of all hospital bed capacity, way more than they should. So it's possible that right now we're in a situation where the short-sightedness of capital and its determination just to keep on turning profits has led to a situation where we've unleashed a disease that has, yes, this very serious respiratory acute phase, but may have longer term devastating impact on the public, on the public health. If that is the case, and there is more and more evidence that that to some extent that at least that is the case, we are going to need to expand healthcare capacity and hospital capacity much more than just that 2% a year, plus dealing with the vacancies and the turnover and so forth. We may have to add, another 10% of capacity just to deal with the healthcare crisis. 10%, maybe more, just to deal with this healthcare crisis. It's emerging science. It's very troubling. It's quite possible capital has created a disaster for our public health. I'm running a little bit long. I promised to only be 15 minutes. So I'm just going to very quickly talk about the privatization in the past. Up until 2000, except for the introduction of independent health facilities by the NDP in the 90s, there wasn't an awful lot of it going on. Around 2000, that changed with the introduction of P3s, and then more and more they moved to things like fee-for-service for surgeries, which allowed privatization of clinics. And the government responded to the crises that this created, particularly the death of a young woman in a plastic surgery clinic when she was being operated on by somebody who wasn't even a surgeon, just a doctor, a family physician. She bled out, died there. There's no emergency room in these private clinics, these for-profit clinics. So all they could do was call 911. She bled out, she died. The government promised to make appropriate oversight of these clinics, didn't promise to get rid of them after that disaster. But the result was that all they did is turn it over to the College of Physicians and Surgeons of Ontario. And they never properly oversaw those facilities. So it's run by the doctors, and their reports were incredibly bare. They would literally read pass or fail. That's all you got out of them. That's the secret of what we're dealing with privatization, or one of the secrets that I think we're dealing with privatization, is that there's complete resistance from the profiteers to public disclosure. Their model is based upon fragmentation of services because you can't mix public and private. It's based upon the idea of commercial secrecy. You can't let your competitors understand your advantages. It's based upon the idea of privileged access for the money class. The public model is completely opposite. It's based upon the idea of integration of services where that provides convenience and efficiency. An expectation, if not always the reality, of accountability and public and disclosure to the public. It's also based on the idea of equality of treatment of everyone, and the insistence on spreading the best ideas from one provider to the other, not the secrecy of keeping the best ideas at one provider to provide a commercial advantage, but the spreading of all the best ideas so that the public can be treated in the most safe way. So I'm 1.5 minutes over. I'll turn it back to Drew and Natalie. Thank you. And I'll stop sharing my cheat sheet.
Thanks so much, Doug. Natalie, take it away.
Okay. Well, it's my honor to be here. Thank you very much. And Doug, you have been on our board as a representative from QP for all of these years that I've been here. And if anyone has led the movement, we've done it together collectively, and with many of you whom I recognize as longtime friends and colleagues and comrades in the struggle. So I just want to sort of take off from what Doug was talking about, but in very human terms. It's almost impossible to overstate the crisis in the hospitals at this point. In the news this week and last week are the children's hospitals, CHEO, the Children's Hospital of Eastern Ontario, Sick Kids, McMaster Children's Hospital. All of them are completely overwhelmed. Like, there is almost no describing the extent to which they're overwhelmed. I'll give you some just concrete examples so you can picture it yourselves. One of our staff, his sister is a respiratory therapist. That means she intubates patients. They put the tube down people's throats so they can help them breathe. She has obviously worked her heart and soul out through the entire pandemic. In the last few weeks, she was telling our staff member that she's worked more than 70 hours a week, 75 hours, 1 week, 72 hours the next week, and still being called in all the time when she's off. They learned by video how to intubate children. They were brought into the children's hospital to intubate children, and they're using the cafeteria as an ICU because they ran out of space, and they're intubating kids in the cafeteria. That's at Sick Kids in Toronto. In CHEO, they announced last week that they were at 185% capacity. That means 100% capacity is every bed is full every single minute of time. There is no break ever. 185 would mean every single bed is full every minute of the time. And there is another patient for virtually every bed in the hospital, stacked in hallways, in the cafeteria, in every space available, waiting to get into beds. That's what CHEO is like right now. McMaster reported that it's running up to 140% capacity, that it is completely overwhelmed. And this is news only because it's new in the children's hospitals. This is what adult hospitals look like, not 185%, but 120, 140, 160% of the mental health beds capacity. That means every bed full. It means it is routine now to have patients stacked in hallways waiting for beds, with no privacy, with bright lights overhead, no one to feed them, and not enough staff. I mean, they're not staffed enough for the beds existing in the hospitals, let alone all the people, you know, waiting in the hallways and so on for care. It's like a war zone in our hospitals. It's like nothing you've ever seen. And we were calling it a crisis before COVID-19. This year is the worst of all of the years of the pandemic. There are a lot of COVID outbreaks in the adult hospitals. There's a lot of COVID cases in the hospitals. The government, as Doug is saying, is really suppressing the information. Like, they really just are not publicizing. It's very hard even for us now to find the data on the number of COVID outbreaks and so on. The last time I looked, there were 155 long-term care homes in outbreak, and I can't remember, 70 something hospital outbreaks or something along those lines, just reams of outbreaks. And these are public health numbers. So what does that look like? Well, a mom with a child who's, you know, this is a mom who's used to going to the hospital, right? She's used to taking care of her very ill, complex child who has autism and a bunch of other things, a whole bunch of healthcare issues, is you know, hooked up to all kinds of tubes and things like that. She needs 24/7 nursing care at home. She lives like that day in, day out. And now, of course, with the respiratory viruses and so on going around, when her child needs to go to emerge. And so this is not a mom who easily takes her child to emerge. They already do all kinds of complex treatment at home for her child. When she took her last week to Sick Kids, for example, to emerge, they sent her home. They didn't have any beds, and they sent her home without care. The mom had to resuscitate her child multiple times at home alone without a nurse present. They can't find nurses to provide home care because of the critical staffing shortages. And this is happening to all of those families. There's kind of a large network of these families with kids with very severe chronic illnesses. And because they have some equipment at home and so on, they're just being sent home without treatment, when normally those kids would be in hospital, in ICUs, even in the hospitals, getting care. There is no question that those physicians warning that kids are dying or will die as a result of this are absolutely true. And that's been true for adults. You know, if your cancer surgery is delayed, your chance of survival goes down the longer it's delayed. That's just the cruel math of it. And that is happening to people all across the province now routinely. So what is the government doing in the face of what is unquestionably a humanitarian tragedy, the like of which we have never seen before? And we don't speak in language like this all the time. This is not, we don't warn of people's deaths, lightly or anything like that. We're not in it to scare the public. But that is the situation on the ground. And the Ford government is staggeringly doing nothing at all, pretending that it's not as bad as it seems. Sylvia Jones, who's the health minister, who you probably have never even heard of because she's that invisible, has, did a press conference today in which she said, we predicted this surge and, it's as expected and so on. What? Come on, that they would be intubating kids in the cafeteria at sick kids? I don't think so. Of course not. I mean, just lies. In the summer, she said there is no crisis, literally said there is no crisis. In the legislature the other day, she said something along those lines. Their plan here is to dissemble, to obfuscate, to outright lie, to pretend it isn't happening and just get through this. I don't know what's going to happen this winter now in this province. They stopped testing. So if you go into hospital with RSV, that's a respiratory virus that is causing massive hospitalizations right now, flu, COVID symptoms, etc. You're not going to be tested necessarily for those things. They used to test. Now we're not testing and tracking because testing is too expensive. And so we don't actually know the rates. I mean, it's obvious we have more and that they're more severe than than we've ever seen. But we don't know what the actual rates of the various different diseases are. There's no real public health ability to track if you don't test. And so the Ford government has two speaking points, and actually media is sick enough of it that they say to me, every time we do an interview on this, the Ford government gives us the same speaking point. We're hiring 6,000 something staff. They say it every single time. And this thing about hiring internationally trained staff, which sounds progressive on the face of it. But first off, it's only like 1,000 this year. It's a tiny amount. Doug was giving you the numbers for long-term care alone. It's 59,000. In the hospitals, it's 40,000. I mean, we need like 100,000 staff today, not 1,000 over the course of the year of internationally trained staff. This is just a practice now that the comms people have, the communications people have, where you just have to have a line. So every time the story comes up, you give that line, and that's the end of the story. And on the global TV or CTV or what have you, the story is told, crisis in the hospitals, la, la, la. And then the Ford government gives its line, and that's it. And it's kind of working because it kind of makes it look like the government has an answer for it and is doing it, even though it's ludicrous. And really, we haven't achieved to getting the media to do its job to say, like, this is ludicrous, and call them on it. So massive crisis in the public system. And at the same time, the government is now privatizing the hospitals and denying that they're doing it. And so there was a story, actually, Doug shared it with me yesterday. It's sort of hilarious. It was global TV. We did a press conference, and we because leading into the election, we did a big campaign, to try and expose that the Ford government was planning to privatize the hospitals. And they kept denying it. They literally were saying to the media, we are not expanding the private clinics. We are not privatizing the hospitals. That was their speaking line. They actually said the health coalition is inaccurate, etc. Well, it turns out that the data from the Financial Accountability Office, which is like an auditor, they're like the Auditor General for Ontario. It reports to the Ontario legislature. So their data shows that in that period of time, the last 3 months of the fiscal year, that's like January, February, March, leading into the election, that's the last data we have, by the way, the Ford government doubled the funding for the private clinics. So while they were out there, literally town after town after town, following us, our press conferences and launch of the campaign and so on, telling the media we are not doing this, they were actually doubling the funding for the private clinics to expand the private clinics behind the scenes. Unbelievable. Lied all their way into the election. So after the election, we held a press conference and said the government lied. They lied leading into the election. Here's the data. We proved it. Only one media person came from Queen's Park for a story about them lying about privatizing the hospitals in election. I'm sorry, but I think that's actually a story. But none of the Queen's Park media came except for French CBC. And then it turns out Global TV actually did do a little bit of investigative research afterwards, and they did a freedom of information request, which is like you have to file to get information out of the government. They sought the funding note, the speaking notes of the Minister of Health, and they also sought a list of who she met with as she was being oriented into her position after the election. What they found was that she met with a private hospital, ClearPoint. It's a private hospital chain, big private hospital chain, in the first weeks of taking office as the new minister, and that they changed her speaking notes to obfuscate in different ways against our campaign specifically. It's kind of, anyway, for what it's worth, you know, they know we're here. They're worried enough about it to try and figure out how to lie to counter what we're doing. But you know, we haven't managed to fight back significantly enough to actually stop them. And at this point, these two things are flip side of the same coin. You know, let the crisis roll on in the hospitals, do nothing whatsoever about it, and then privatize. It's, you know, that create a crisis and privatize. And we're seeing it, you know, writ large in front of all of our faces across Ontario. So what are we going to do? Very quickly, we're going to fight back the same way we have before, but on a larger scale. Our assessment of this is that the Ford government is very serious. This was a plan to wait until after the election, first year of a new term, do all of the unpopular things right away, get them in place so that they're irreversible. And, you know, they sat in the summer, which governments don't usually do. The first thing they did was announce their plans to privatize the hospitals. The second thing they did was bring in Bill 7 to force the elderly out of hospitals into long-term care homes, not of their choosing, against their will, right? Those were the two things they did in August when they brought the government back. And now they're, you know, creating a crisis in education and trying to undermine. Actually, you know what they did with Bill 7? They took a chainsaw to the Charter of Rights for seniors, just as they took a chainsaw to the Charter of Rights for education workers a few weeks ago. And so what we're going to roll out a series of town hall meetings. I'm just going to share my screen quickly. I'm trying to speak quickly, so I'm not taking too much of your time. Share. And this is just our Facebook page. It's on our webpage as well. So we're doing town hall meetings in 13 towns to start. They start Monday in Ottawa. They're by Zoom because obviously the state of the pandemic is terrible. And now we have a flu epidemic as well. We don't want to be super spreaders. So they're super easy to join. You can just, you know, like you are on this, click on the link and register and join. Ottawa is Monday at 7. Chesley, which is the place that Doug was talking about, I think their ER is open right now, but it's routinely being closed overnights. It's been closed 7 times, I think, since in the last few months. That's Tuesday, along with, Perth and Smiths Falls. Also Tuesday, Perth's emergency department was closed for months. Very, very serious risks to these smaller hospitals. Ooh, where's the list? There's a full list somewhere. Hang on, I'll go to my website. Our website. Here they are. Then Waterloo on Wednesday, then Niagara on Thursday, then Durham, like the Oshawa, Ajax, Pickering would be on Saturday morning, Windsor Saturday after at noon, Clinton, which is a small town in the west, on Monday at 7, Kingston as well on Monday at 7, Toronto on Tuesday, that's of the next week at 7, Seaforth also on Tuesday at 7, St. Mary's on Wednesday at 7, and ending in Hamilton on Thursday at 7. So we have the town hall meetings, and out of those, we're going to roll out the action plan. The action plan is to sign up 1 million Medicare defenders. And those Medicare defenders would make a commitment to taking a leaflet door to door or in their community or in their workplace, to signing up more Medicare defenders of public Medicare, to handing out surveys for people to fill in if they paid for services in private clinics. Like we're hearing the cataract surgery clinics, the ones that exist, are charging now $700 for extra eye measurement tests, $5,000 for cataract surgery, illegally in violation of the Canada Health Act. What Doug was referring to, these private clinics, when they come in, their business model is not just to charge OHIP, they charge OHIP, but then patients on top. That's how they maximize their profits. So we want to get the evidence of that and patients who can speak about it. So we're going to ask people to fill in surveys. John, I'm thinking like the, the SOAR chapters, the Steelworkers retiree chapters, if their members would fill in the surveys and so on, everywhere where there might be groups of people who are using private clinics. So we can gather that. They can fill them in anonymously or with their names. It's their choice. And then we're going to hold marches on bridges. So big protests on bridges like the Quebec nurses did, with healthcare workers and the public supporting. And we'll work it out in the town hall meetings, but it looks like we'll do Ottawa, Toronto, Windsor, and possibly a few places in between before the winter break. And then after the winter break, we'll do another set of town hall meetings to protests and the action plan, keep signing up the million Medicare defenders. And where is this going? Well, ultimately, I hope job action to stop them and or province-wide referendum, which would, if we could get 1 million votes against privatizing the hospitals, that would stop the privatization of the hospitals. And we can do it if we pull together to do it. So that's it. Thank you.
Thank you so much, Natalie. I'm sure everybody's clapping, but everybody's muted, so you can't hear. It really is a terrifying situation that you've described, but I do, if anything, if this fall is also proven that Doug Ford's, he's clearly moving fast and furious, like you said, to on every front, against municipalities, against education, against healthcare. So he's going as far as he can, but also the fight back's building quite quickly. So I really do think that the renewal of the anti-privatization campaign from the Ontario Health Coalition, I think it will get some attention very quickly. And we certainly will do what we can to plug people in. And if people can go to that link that's in Gustavo, thank you for putting it in the chat there. You can go to the events list and sign up